Okay, so summarizing our thermal and our non-thermal effects and how they then affect these various areas that we've been talking about for all modalities. So on the injury response process, ultrasound application effects depend on if we're doing continuous or pulse, depends on the frequency we set, depends on the size of the area, and the type of tissue. So the vascularity, the density, the amount of collagen in that tissue. So deep thermal effects become similar to those that we talked about on the thermal therapy and their effects on the tissue response process. And so ideally, if we're in the inflammatory response phase, we do not want any thermal effects. We wouldn't use thermal ultrasound. We would maybe use our non-thermal effects to help facilitate, but we would not use any of our thermal. Looking at the cellular response, that acoustical streaming and the cavitation increases that cell membrane, also changing the diffusion rate. So we usually get this increase in healing type things like histamine, intracellular calcium. We get this mast cell degranulation, so we're less likely to get scar tissue, and it looks more like the more original tissue. Increased rate of protein synthesis, and then if we're doing our thermal effects, right, on the cellular level, if we increase temperature, we increase cell metabolism, and then that also increases the rate of inflammation. So speaking of inflammation, those changes in the cell permeability will result in, again, changes in the tissue, so less likely to be kind of the sporadic scar tissue. We get a release of growth factors and platelets that help fibroblasts come to the area and do their job. Continuous ultrasound also has been shown to increase macrophage activity. So again, thinking late stage inflammatory into proliferation when we're doing our cleanup. So the leukocytes can get to that area a little bit clearer. And when applied during the proliferation phase, ultrasound tends to stimulate cell division, which is important for growth. Blood and fluid dynamics, if we're using continuous ultrasound and thermal effects, right, we're definitely going to get the increased blood flow. We get dilation of blood vessels, more histamine release, which also dilates blood vessels. On nerve conduction and pain control, nerve conduction velocity is increased with the thermal effects. Cell permeability to sodium is affected, so that alters the pain threshold. So usually increases our pain threshold so that we don't sense as much pain. It also reduces the activity of those pain receptors. Okay, by the increased blood flow, we remove more of the things that would be irritating to those chemical sensitive pain receptors, and so we get a decreased pain in that mechanism. On muscle spasms, we reduce the mechanical and the chemical triggers that cause that pain spasm cycle to continue. The heat helps for an analgesic effect. We get relaxation of muscle tension. That increased blood flow, again, helps to kind of move the muscle along and remove those irritants in the area. We get increased delivery of oxygen, which helps break down that ischemic hold on those cells and the pain that's produced by those cells. And again, especially if we are talking the vibrations, we got that breakup in the collagen, so it helped kind of loosen up that collagen. And then as we're really talking about increasing the temperature up to our vigorous heating, we get aiding in the elongation of those muscle fibers, which will also help relaxation. On tissue elasticity, so we specifically can target, again, those collagen-rich tissues, and then we can get to that vigorous heating level, okay, and then use that stretching time, so during the treatment as well as a couple minutes after. 3 megahertz gets more heat to that area, especially if it's more superficial, than the 1 megahertz, so we might have to have a slightly longer treatment with the 1 megahertz. But it's also not effective for large areas of muscle because we have to target only 2 to 3 times the ERA, and that stretching window is going to close. We have to do that treatment to that smaller area and produce the effects that we're going to get. And then on muscle and tendon healing, some research has shown 1 megahertz continuous output ultrasound enhances the release of fibroblasts. So again, more likely to be building and healing. And 3 megahertz ultrasound has increased cells' ability to synthesize those building blocks of fibroblasts, so more likely to produce the fibroblasts that will produce the healing. So especially in areas, again, that have those high collagen content is going to be the most effective. And then on wound healing, okay, some superficial wounds have responded favorably to ultrasound application, while others, research-wise, it's a little bit mixed. Um, Again, this is for wounds that we could actually see, like thinking about our typical wound care. Continuous ultrasound delivered at 1.5 watts per centimeter for a 5-minute treatment over 1 week showed an increased break strength. So when they had stitches, incisional wounds, or not necessarily stitches, but just wounds that were healing, they were then able to test that those wounds were stronger, less likely to break with ultrasound versus without. And that ultrasound applied at 1 watt per centimeter squared or applied using continuous output might also have an inhibitory effect on wound healing, depending, again, on what stage they're in. And the thought being that if you have a lot of dead tissue around that area, it doesn't dissipate the heat like you would think, so it overheats and can actually inhibit that healing process. So you would need to think about the timing of when you're using ultrasound for wound healing.